do an angiogram, he'll first give me a blade and say shave and come. I have to shave the whole pubic area. मेरा काम है क्या? To shave, thigh पूरा shave करना पड़ता है. One cut he'll throw me out because that can cause an infection. Cut नहीं चाहिए. Okay? So unless they make me do it. But if I make you do it, you will make 10 complaints. Okay? So this is the coldness area. Accessibility आपके ऊपर है. Theory बताना मेरा काम है. But don't get into trouble by causing damage. कभी भी अगर आपको पता नहीं है, अगर आपको confidence नहीं है तो मत जाइए. Confidence धीरे धीरे build up कीजिए. Okay? I can make you do it. I can hold your hand and make you do it. Right? Yeah. So if you look at the next, you saw this picture. You saw this picture here. This is the whole process, and in this process you can have an interpretation like this. This is the coldness stage. यहाँ पर सब कुछ मिलता है आपको. ये process है. This is the cervical vertebrae से जाते जाते यहाँ तक पूरा एक structure मिल जाता है. यहाँ अगर treat कर सकते हैं, this is the coldness stage, and you will get your results are wonderful. Because most pain is coldness, especially skeletal mets. Okay. See, I'm sometimes very greedy and things like that. My father had CA prostate, cancer of the prostate. Okay, and he had secondary mets, extensive mets. So he was given about 5 months to live, and I said, let me work with him. Itna sab sikha hai. We could pull him along for 5 years. During the last stages, when the organs were shutting down, he would shirk in pain. That was the time I took my probe and I started to, because he had extensive mets. उसको कान में सुनाई देता है, नहीं सुनाई देता है, वो फर्क नहीं पड़ता है, उसको दर्द नहीं आना चाहिए. But I took care not to hurt, not to cause any damage. So I have used this on him. And I had to shift him, otherwise he'll get a bed sore. So the first time when I shifted, he grinned in pain. He said something like that. So I didn't do it. Then I said, what to do? Otherwise he'll have a bed sore. And that is all the more dangerous. I cannot touch his hand and things like that. It's already secondary spread. Bone is not available. I cannot move him. But he is lying like this. So I can bend down. I put a loop, looked at the external auditory canal and started stimulating this area. The minute I did that, very gently lifted him from one bed, changed the sheet, put an air bed, put him. No grimace. तो काम करता है. Okay? It works. Here you have the representation of the vertebral column. You can have representation here also. This is structural. And this is the lung, this is the heart, this is the liver, this is the gallbladder, this is the intestine, this is the uterus. Okay? Surface anatomy यहाँ पर represent किया है. आप surface anatomy जानते हैं, coldness जानते हैं, तो यहाँ पर needle लगाइए, treatment कीजिए. ये coldness का stage है. Coldness is the end stage of all condition. Coldness is death. Coldness is necrosis. Coldness is excruciating pain. Coldness is extreme pain. It is accessible here. Now you build that skill and technology to reach up to this. Or you sit here, come here, 10 o'clock, 11 o'clock, 12 o'clock, we'll do it here. Choice is yours. But is this possible? If we can have representations like this, can we have a representation in the external auditory canal also? In the process of turning like this? See, इसको एक सिर्फ visual treat मत बनाइए. अच्छा लगता है, सुंदर लगता है, इसको फोटो निकाल दिया और उसको एक चार्ट बना के क्लिनिक में लगा दिया, ये फायदा नहीं करता है. इससे अच्छा चार्ट सबको मिल जाएगा. इसको इस्तेमाल करो. खाना सामने रख के ये मत बोलो कि अच्छा है, खा के देखो. कभी न कहीं हड्डी निकल जाएगा, कहीं पत्थर निकल जाएगा. उसको आइसोलेट करना सीखो. ग्रुप में डालो. आपने ये बताया था इसमें ये हड्डी है, इसमें ये बाल आ गए, इसमें वो बाल आ गए, तो हम लोग निकालेंगे उसको. पवन जी सेड नीचे हीट और हॉटनेस स्टेज. गलती हो गया भाई, आप नहीं निकालेंगे, कल कोई और थप्पड़ चप्पल मारेगा. तो use it. Okay, onset of the second stage of the intrauterine development. Now this is the fetus at the coldness stage of up to 31 weeks. You see here in the initial part the cells were coming, fertilization हो रहा था. यहाँ पर already formed ये fetus है. The fetus will have its correspondence system deep in the auricular tube, external auditory canal, and will have a cephalic presentation. What do you mean by cephalic presentation? This is called as a cephalic presentation. It is ready. This is called as a breech presentation. This is called as a cephalic presentation. Okay? Yeah. The gluteal area would correspond to the tympanic membrane. Okay? I haven't touched that area. Okay? The gluteal area will correspond to the tympanic membrane. Okay? Now this is how it is. This is a coldness image. Okay? This is the coldness image. Okay? This is the spleen area. This is the kidney. You see, this is the ureter. These are the hands. Now this is the after coldness, fetus at its dryness stage up to 34 weeks. Now very similar, you will see that initially it was the head up, now it is head down. It was the hetero, now it is the homo. Okay? So fetus at the dryness stage up to 34 weeks. From the 32nd week, fetal hemoglobin will supersede the standard one and the immune system starts functioning. So who said immune system? Immune system is dryness. You get the dryness here. See, when did you know that the immune system is dryness? Only after professor developed all the higher theories, right? This was way back in 1997. एक आदमी सही होता है ना, उसका फाउंडेशन से सही होना शुरू करता है. कोई बीच रास्ते में आके सही नहीं होता है. उसको पता नहीं रहता है कि मैं सही हूँ, लेकिन जब ईमानदारी से करते हैं ना तो अपने आप एक क्लिक होते जाता है. जब मेहनत करते जाते हैं, गलतियां हो सकती है, लेकिन यू क्लिक, यू फॉल इनटू प्लेस, एंड एट द एंड ऑफ इट यू कल्मिनेट. You look at the life of any great person. Abdul Kalam wanted to fly, he wanted to become a fighter pilot, he didn't happen, he was depressed, he went there, he did this, he did that. At the end of it, when he said, I became the president of India, I went to the chief of air staff and said, I want to sit in a plane, I want to learn flying, and the chief of air staff stopped him. उसका ख्वाहिश था कि flying सीखे, वो supreme commander भी बना. Are you seeing that? एक आदमी सही 1984 से सही करता गया. He didn't have the advanced theory. Embryologically, he said fetus at the dryness level. He would never remember this. I don't know if he remembered all this. He gave us the theory, he went forward. But when you correlate, today he says fetus at the dryness stage, and here he says the immune system starts functioning. Any immune related problem, can you not treat the dryness area in the inverted fetus correspondence area, in the head down correspondence dryness stage? Yes? Okay. Immune system start.
You should the thymus correspond at the point, right?
Yes. Yeah. Okay. The immune system starts functioning. The correspondence system will be found in the cartilaginous portion of the auricular tube. यहाँ से cartilage शुरू होता है. The entrance of the external auditory canal, you will see the extension of the cartilage. It starts here. Okay. Similar, wherever the head up stage is there at the entrance of the external auditory canal, even the head down you'll find there. Do you find any difference? Do you find any difference in the area? Only thing is there it is head up, here it is head down. Yes? Okay. Most important is this information is important. ये information आप build up करते जाएंगे. वो बलराम notes xerox कर दिया. Okay. See, I don't want to limit you to this. It is possible. I can discuss, 10 immune conditions and spend half a day, 1 hour, 2 hours, 3 hours, and finish off with one interpretation. मजा नहीं आता है. Okay? Rather, I would prefer to spend 1 day with embryology and then finish all these interpretations in 1 day. So you know the cases and you can put the needle. Okay? ठीक है. So fetus at its dryness stage up to 34 weeks. This is how it looks. This is the surface anatomy. It's at the entrance of the external auditory canal. Okay? Now, fetus at the humidity. See, in the dryness you don't have the posterior part. You don't have the posterior part. You only have the anterior part or the lateral part. Alright? Fetus at the humidity stage up to 35 weeks. There is weight gain due to the, see again humidity में weight gain आता है. तो यहाँ पर weight gain कैसे दे रहा है वो? हाँ ठीक है, तो खाना खाने के बाद जब आएंगे तो उनको नोट्स पकड़ा देंगे, उसके साथ सो जाएंगे. ओके या ठीक है. So there is weight gain due to the formation of the subcutaneous fat. The fetus will have its presentation in the cavity of the concha. ये टेक्स्ट बुक फिगर है, देखते हैं फिर उसने क्या बनाया. ये ह्यूमिडिटी में उसने पैनक्रियास आइलेट्स ऑफ लैंगरहंस लगा दिया. सर शी हैज लर्न सुजॉक से, सर मैं पैनक्रियास लगा दूं क्या? लगा दे. तो कम से कम वो तो ट्रीटमेंट कर सके. सी दिस इज ये ब्यूटी है टीम का. Okay, when I sent the PowerPoint presentation to Dhaval to bana de, and I kept quiet. 3 to 4 days I dumped it on him. ये टीम का एक एडवांटेज है. If you have a team, you rest assured. He will do his job. He knows I will do my job. मुश्किल है, तकलीफ है तो साथ में काम करेंगे. उसका काम मैं कर सकता हूँ, मेरा काम वो कर सकता है. Right? So life gets easier. सपोज ऐसे धवल आई हैव गिवन यू, तुम उसका मिसयूज करेगा, मैं उसका मिसयूज करूंगा, तो काम नहीं चलता है. भरोसा है. Yeah, that's trust. So build a team. You will grow farther. You will grow longer. So this is the Dhaval. Can you zoom out? It's blurring. Yeah. Okay. So what is this? What is this? Uterus. Uterus correspondence. Okay, this is the pancreas here, this is the liver here, this is the gallbladder. Okay, this is the spleen. Alright, you can't put all the organs because the area is small. It's not that it is not there. I cannot put it. Then if I have to put it, I have to draw 25 figures for each correspondence. एक लाइफ टाइम बन जाएगा, ऑरिकुलर ये नहीं पड़ेगा. तो इससे अच्छा है मैं आप 3 महीना बैठो, स्ट्रक्चरल एनाटॉमी सीखो, फिजियोलॉजी सीखो, पैथोलॉजी सीखो, फिर यहाँ पर करते 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 जाओ. ओके okay, so this is the fetus of the humidity stage in the medial part. This is the humidity stage. You see it looks roly poly, मोटा लगता है. Okay, it looks chubby also. This is the humidity stage. Now fetus at the wind stage of 36 weeks. The fetus demonstrates the maturation of the auditory, gustatory, olfactory and visual sense organs. See the maturation of the auditory, gustatory, olfactory, visual sense organs. The corresponding system will occupy the entire floor of the auricle, Simba concha, concave cavity of the concha. यहाँ तक आ जाता है. Yeah, पूरा नहीं आता, ये wind stage है. Head up में जो आया था, whatever the boundaries were there, please understand within the boundary you can do anything. तो boundary आ रहा था, उसी boundary में fit हो रहा है. Okay, this is the lateral, this is the medial, the posterior. Now what we have drawn here is this. Okay, simple.
Sir, may I ask you to see the back end again?
This one here.
No, the letter figure. Yes, this one.
हाँ, डबल फोटोग्राफ के लिए एक्स्ट्रा पैसा लेना पड़ता है. Okay. Finished? Okay. This is the fetus at the wind stage. Right? Yeah. Now this is the fetus at the wind stage in the head down correspondence area. This is the area of the brain. The whole of the brain correspondence is represented here. You see, this is the area of the hand, this is the area of the leg. You have a problem with the movement, you use the functional knee correspondence to move. Wind is for movement, osteoarthritis, calcaneal spur, okay, anything that's got to do with movement. You see, you get a clear area for the lung here. Respiratory disease, movement, right? If it is chronic, This is hetero in nature. This is homo, this is hetero. Yeah. So you have a hetero condition, you do the treatment here. We will learn the application of all this. ठीक है, इसको हम interpret करेंगे. We'll have a discussion unless you don't want it. You decide. Okay. So yeah. Now this is the fetus. See, this is the figure in the textbook. मेरे फिगर खत्म हो रहे हैं और दोपहर आ रहा है. ठीक है, ये स्टॉप नहीं, ये खत्म करते हैं. ठीक है, नहीं कंप्लीशन हो जाएगा, मतलब बीच में. ओके, मेरा फिगर खत्म हो रहा है, उसके बाद यही फिगर है. सो डोंट स्लीप ऑफ, डोंट गो अवे फ्रॉम हियर. ओके. Yeah. So this is the fetus at the heat stage up to 38 weeks. The neural and the associated connections are developed and differentiated. The reflexes like swallowing, suckling, etc. are fit to function. The corresponding system will be projected in the auricular cavity. Where will you have ये reflexes कहाँ पर कम होते हैं? Probably stroke, injury, trauma, brain trauma में कम होते हैं. और ये भी heat का है. तो इसको हम लोग treat कर सकते हैं. अगर आप एम्ब्रियोलॉजी का किताब पकड़ते हैं तो ये रिफ्लेक्सेस कहाँ पर है आपको पता चलेगा. वो करस्पॉन्डेंस में पिन पॉइंट करके वहाँ पर स्टिमुलेट करने से ये आ सकता है क्या? कोशिश तो करके देखो. So this is the heat stage where she is just on the cardiovascular system. This is the blood vessel and this is the kidney. सिर्फ एक ही ड्रॉ किया है. So बहुत कुछ कर सकते हैं. This is the heat area. This is the posterior, the heat. Okay. This is the lung, hand. This is, what is this? Thyroid, trachea, esophagus, lung, cross section of the heart, right? Stomach, liver, gallbladder, intestine, small intestine. Okay. Testicle. This is the male reproductive organ. So intricately she is drawn. Okay. Yeah. Now this is the fetus at the hotness stage up to 40 weeks. End of the fetal period 50 centimeters in length. Ready for birth. The corresponding system will occupy the entire auricular region. This stage coincides with Nogia's description. ठीक है. पूरा ये पिक्चर आपको इंटरनेट में मिल जाएगा. This is what Dr. Paul Nogier has given us.
So Nogier is very limited.
Now you understand? क्या? 4 दिन लगे? यार दुनिया को लगने में कितना टाइम लगेगा? दुनिया को तब लगेगा कि ये साले गधे लोग इतने ताकतवर बने कि जाएं और ये सीखे और बताएं.
फिर भी आप 10 महीने की चीज में 4 दिन में कर दिए.
हाँ?
10 महीने की चीज है.
So this is, you see, this is the representation. This is Dr. Paul Nogier's representation. Okay. In Dr. Nogier, you will see that
It's very different.
clear. This is ready for birth. You will see the entire organogenesis has taken place. Do you see this is a cross section? उसने rib काट के आपको cross section दिखाया है अंदर. Okay? It's not just superficial anatomy. It's internal structure. So it's a very clearly thought out figure here. What she wants to show you is very clear. You see this? She has followed the contour. She has not missed that. It is within this. You see this is the bone and you see the demarcation of the feet here. This bone she has not put, but up to here, following the contour, she has built the tibia and the fibula and the femur here. And this is the patella here. So this works anatomically because you have got this from Netter's anatomy, you have got this from embryology. It's made so easier for you. All that you have to do is do the treatment. Remember this, do the treatment. This is the gallbladder area, this is the stomach area. This is the transverse colon, this is the ascending colon, this is the appendix. This is the appendix here. Okay, this is the, what is this? This is the funny bone. What is the funny bone?
This is the humerus.
Yes. The humerus is called as the funny bone. Why? Okay, I thought they tickle you and you laugh. So this is the funny bone of the humerus. This is the place where you can treat adhesive capsulitis. This is the place where you can treat carpal tunnel syndrome. This is the place where you can treat either tennis elbow or golfer's elbow. Lateral epicondylitis, medial epicondylitis. You have written it there. I'll ask you to explain it. You explain that because I've given you the points here. You talked about the whole world is fighting. पता नहीं यार HIV और AIDS कैसे पता चले. आप immune system ठीक करो फिर देखो. मैं promise नहीं कर रहा. आप देखो एक क्या बोलते हैं. It's an idea. An idea can change your life. शुरू तो करो. एक सोच है. सोच दुनिया बदलने की ताकत रखती है. बिना सोच के हम कुएं के मेंढक बने रहते हैं. Okay, so this is the fetus at the head up stage which corresponds to the no gears limited. The first stage of the intrauterine development has the embryo in its head up position and the head of the embryo or the fetus exceeds the size of the body. There are 6 different interpretations of this type. We have seen this. यहाँ से एक recap करेंगे. तो recap के पहले shall we stop here for lunch? Yes? Okay. You're happy today?
Yes.
वो 3 दिन का घिसा पिटा लेक्चर ये आज पता चलता है. ठीक है. अभी डंडा लेके आएगा. मेरा नोट्स आएगा आपको दूंगा. इस बार तो आपने पिक्चर देख लिया. अगली बार ये एम्ब्रियोलॉजी नहीं रहेगा. ये इंटरप्रिटेशन के ऊपर फोकस करेगा. ओके. राइट नाउ he has given you the embryological development and we have given you a visual treat. But after this he will go on presentations, front, back, left, right, contralateral, ipsilateral, left, right, right, left. तो वहाँ पर आपका चैलेंज आएगा. वहाँ पर इंटरेस्टिंग बनाने के लिए आई विल ब्रिंग इन एम्ब्रियोलॉजी अगेन. तो आपको नोट्स दे रहा हूँ. विल कम बैक. व्यर्थ नहीं जाएगा. सो वी स्टॉप फॉर लंच. इट इज 12:40. हाउ मच टाइम? 1 hour धवल और 45 minutes? 1 hour. So it's about 12:40 on my watch. 1:40 we will come back. Okay. Thank you very much and thank you for those.